I'm Shelby, and I'm the Public Education Coordinator for the Epilepsy Association of Calgary. Today I'm going to tell you about the different seizure types, how we should respond to them, and let you know more about the Epilepsy Association of Calgary. So, what is epilepsy? Epilepsy is a condition of the central nervous system characterized by recurrent seizures. About 2% of the population have epilepsy. That's 1 in 50 people. Epilepsy is not contagious, and anyone can develop it at any time in their life. So what causes epilepsy? Head injuries, infections, brain tumors, strokes, chemical imbalances, or trauma during birth can all cause epilepsy. But for 50 to 60% of people with epilepsy, they do not know the cause of it. Now, what is a seizure? A seizure can be described as a lightning storm in the brain, where many brain cells get overcharged at the same time. The brain directs the body by sending tiny electric signals between neurons, but sometimes the neurons fire inappropriately, and that can cause a seizure. It's a sign that something is going wrong in the brain, just like a fever is a sign of an infection in the body. Anyone can have a seizure. It might be because they have epilepsy, but it could be a diabetic seizure or a seizure caused by alcohol withdrawal. What does a seizure look like? I think a lot of us have seen seizures represented in the media, like movies and TV shows, as convulsions on the floor. Now, this is what a seizure can look like, but it can also look like a change of awareness or a brief stare. For most people, seizures are brief and infrequent, and a single seizure does not mean a person has epilepsy. An epilepsy diagnosis happens with recurrent seizures. Now we're going to talk about the main types of seizures. There's 2 main types, generalized and focal. Generalized seizures are a seizure that involves the whole brain, and a focal seizure is an episode of abnormal activity in a specific area of the brain. Now, within generalized seizures, there's 2 types of seizures. The first one we'll talk about is generalized motor seizures. Now, generalized motor seizures involve the whole brain and involve the body moving. A type of seizure that we often recognize as this generalized motor seizure is tonic-clonic seizures. In tonic-clonic seizures, the body stiffens, the person may release a loud cry and fall to the ground, they might have rhythmic jerking, their skin may change color, they may bite their tongue or cheek, and they may lose control of their bladder or bowel. Tonic-clonic seizures last 1 to 3 minutes, and usually consciousness is slow to return. This type of seizure can be the most alarming to witness, but we must remember it is temporary and it is unlikely that it's life-threatening for that person. As the seizure ends, the person may have labored breathing that sounds like choking, and they may vomit. They may have a period of confusion that lasts 10 to 15 minutes, and they will be tired and need to rest. The second type of generalized seizures, that's seizures that involve the whole brain, are generalized non-motor seizures. An example of this type of seizure is called absence seizures. These seizures often occur in children. It involves a sudden brief loss of consciousness, repetitive eye blinks, and some slight muscle movements around the mouth. It resembles daydreaming. These seizures can last 2 to 10 seconds and have no recovery time. Some people may have hundreds of these type of seizures a day. It's not necessarily typical, but it's possible. So we just talked about the 2 types of generalized seizures, motor and non-motor. Now we'll talk about focal seizures. That's the type of seizure where there's abnormal activity in a specific area of the brain. The first seizure we'll talk about is focal seizures with impaired awareness. This is mainly experienced by adults. It's a loss of awareness in surroundings, where the person might appear dazed and confused, and it's characterized by repetitive movements such as lip smacking, random walking, picking at clothes, or mumbling. These seizures can last 2 to 4 minutes, and the recovery is a gradual process. People having these type of seizures may appear to be conscious because they might walk around and their eyes are open, but they are not in control of their movements, speech, or actions, and they will not remember what happened during the seizure. They may even continue doing the activity they were doing in a mechanical way. They may repeat a phrase over and over, but they will not be able to recognize dangerous situations like stairs or a busy street. These type of seizures typically begin with a blank stare, a loss of awareness, followed by repetitive movements. The last type of seizure we'll talk about is focal seizures with awareness. In these type of seizures, there's no loss of consciousness or awareness, but there is a change of senses or a change in motor activity, usually isolated to one group of muscles. This change in the senses may be tingling in fingers, a metallic taste in the mouth, ringing in ears, or a sudden feeling of fear or anxiety. So, in summary, we talked about generalized seizures and focal seizures. Generalized seizures, we talked about motor, the example is tonic-clonic, and non-motor, the example was absence seizures. We also talked about focal seizures, and those can be focal seizures with impaired awareness or with awareness. We should note that lots of people have more than one type of seizure. So, how can we help people who have seizures? If you know someone who has seizures, you may want to know about their triggers or if they experience auras. Triggers are internal or external factors that may cause a seizure. This could be missed medication, lack of sleep, or flashing lights. An aura is a focal aware seizure. That's a seizure we just spoke about that involves a change in senses. Sometimes people have auras before a bigger seizure. If you learn to identify auras or triggers, you can help prepare to support someone with seizures, or you can actually help prevent seizures. The main principles of seizure first aid are stay calm, protect the person from harm, do not restrain the person unless they are in imminent danger, and remain with the person until they have fully recovered. I'll talk now more in depth about tonic-clonic first aid because tonic-clonic seizures can be quite hands-on when it comes to first aid. If someone's having a tonic-clonic seizure, you'll want to move harmful objects out of the way, cushion their head, remove glasses and loosen tight clothing, and when the convulsing stops, you'll want to roll the person on the side into a recovery position. This allows fluids to drain from their nose and throat so that they're not inhaled or choked on. And you should avoid doing this if you suspect there's been a neck or back injury. Don't do CPR unless the person is not breathing after the convulsions stop. Some do nots for you. Do not restrain, do not put anything in their mouth, and do not leave the person until they are fully oriented. Just to be clear, I'm not a doctor, and these are very typical responses to seizures. If you do know someone who has seizures, you're going to want to talk more in depth with them about how to support them. This is a very basic knowledge for anyone to follow, and we'll talk a little bit more about how we can be supportive. So for all types of seizures, you're going to want to move harmful objects out of the way. If the person is wandering, gently guide them away from danger, like stairs or traffic. Again, always offer that reassurance that you're there to support and you're going to stay with them until they're feeling aware and better. Again, no matter what kind of seizure, do not restrain the person. Something you may also want to consider is providing the person who's had the seizure with the missed information. If someone is known to have seizures more often or a few in a row, you might want to assign a buddy to them to help them keep up with the activity that's going on. That might be school or a sporting event. And again, keep offering that reassurance. So when is medical attention needed for a seizure? If the person has no medical ID, like a necklace or a bracelet indicating they have epilepsy and you don't know that person, you would want to call for medical attention. If the seizure lasts more than 5 minutes, the person doesn't regain consciousness, they have a second seizure without recovering, they're pregnant, injured, or diabetic, the seizure occurs in water, or it's followed by a severe headache or prolonged pain, all are reasons to call for medical help. If you want to prepare to assist someone with epilepsy, you should gather this information from them. How frequent are their seizures? How are their seizures usually handled? Are there known triggers? Is there an aura prior to the seizure? and what, if any, emergency procedures should be followed. Another thing that's very helpful is recording the seizure. So your role could be being very observant and recording what happened before, during, and after the seizure. Document those details. They can be helpful for the person having the seizure. Epilepsy can be a stigmatizing condition. Another way to support someone is to just be a friend. That means being inclusive, avoiding labels, and focusing on the person's strengths. Seizures may be an obstacle to someone achieving their goals and dreams, but they're certainly not a wall. People with epilepsy can achieve just as much as people without epilepsy. And that's actually what the Epilepsy Association of Calgary is here to do. So this association has been around for 65 years. We support independence, quality of life, and participation for those with and affected by epilepsy. We provide education, support, community events, and awareness campaigns to increase understanding of epilepsy in Calgary and the surrounding area. This support is provided through individual counseling or counseling with families, adult support groups for parents, wellness skills training, and courses and seminars with specific information relating to epilepsy. The education piece includes community presentations similar to what you're seeing now, opportunities to volunteer, a newsletter, and promoting Purple Day for epilepsy awareness. There's also community events like summer picnics and Christmas parties to bring people with epilepsy and affected by epilepsy together. You can contact the Epilepsy Association by calling 403-230-2764 or emailing info, at epilepsycalgary.com. You can also find information about the Epilepsy Association of Calgary and about epilepsy in general at epilepsycalgary.com. You can find the Epilepsy Association also on Facebook, on Twitter at Epilepsy Calgary, or on YouTube. Thanks so much for watching.